Hello and welcome to Chat with Dr. Kat. I'm Dr. Kat. It is great to see you today. Today we have a guest, Myriam Barthes, and she is the co-founder and CEO of Journey Clinical, which is the largest platform for psychedelic-assisted therapy. So just sit back, have an open mind, and let's explore the possibilities of psychedelic intervention-assisted therapy. Welcome, welcome, welcome. Please tell me about yourself and tell me about psychedelic-assisted therapy.
First of all, thank you so much for having me on the podcast. I
Welcome.
very much look forward to our conversation, to talk to you and to your audience about psychedelic assisted therapy. This is often very mystical for people. And so I am very excited to bring some practical tools and tips and realities to this. And one thing that is important when we think about psychedelic assisted psychotherapy, it's really the combination of the psychedelic medicine with psychotherapy. And we believe that this is what enhances clinical outcomes. In psychedelic, what we call dosing session, you typically have an experience that can last with ketamine about 2 to 3 hours, or with psilocybin closer to 5 or 6 hours. Same with MDMA and other psychedelics. And what we do is we add with that what is called preparation and integration, which is essentially psychotherapy, so
Okay.
that one, people can prepare for the experience and then also integrate insights into daily life.
Um, I'm so eager to hear more about this. There's a lot of different things out there, lot of different opinions, but you've actually started a company, and it's called Journey Clinical. Tell me a little bit about that and how many therapists do you have involved?
Yes, of course. So Journey Clinical, we started in 2021 in our living room during COVID.
Yes.
And what the premise was, psychedelics are unparalleled when it comes to clinical outcomes. And so we need to figure out how they can enter mainstream mental health care. And our ethos at Journey Clinical was the therapist, licensed mental health professionals who went to school for a very long time, have a degree, and already see clients for psychotherapy. And so what we tried to do was, how do we empower licensed mental health professionals to integrate these new modalities into their own practice? And what we built over the years, what we understood, that the first thing that psychotherapists needed was to have a medical partner. So we built a medical organization so that the medical team can take on the patient eligibility, the prescription, as well as ongoing monitoring. So that's the first thing that we built. Then, this was during COVID, and therapists were, for the most part, at home, like most of us.
Right.
So the need for community emerged very strongly. And as we know, a lot of therapists are solo practitioners as well. And so we really built a very strong community with a digital presence as well as in-person events. We actually have done almost like one event a day for the last 5 years for therapists to meet. Of course, education has been a key component of
Yes.
this as well. Because when you start this work, you first need to be trained both with didactic training as well as experiential learning, and then you need to continue training, peer consultation, group mentorship to talk about what comes up. And then the last two things, of course, were insurance.
Sure.
The, this is, because we need to allow these treatments to be accessible for clients, and all kinds of resources, informed consent, legal resources, marketing resources. I think at Journey Clinical, there was this question, how do we even talk about psychedelic assisted therapy?
Right.
What is the language for this? And so we've built that over the years, and then we opened the marketplace to patients so that now we have a directory and they can actually find and get matched with a therapist that is in their local area, accept their insurance, is trained. And this has been a very, very beautiful journey with about 3,000 therapists on our platform. We're open in about 30 states. We've done over 1 million hours of ketamine-assisted psychotherapy and Spravato. And are growing with additional psychedelics that are coming through the FDA pipeline as well.
That's wonderful. In my experience, being one of the founders of online therapy, exactly what we had to do. It's almost the same model as you have to train therapists because, therapists, our whole thing is about safety. Safety is first. And, with online therapy, I remember walking into a room, I was at UCLA, and there was, I think there was about 500 people. They wanted to come and hear about it. And I decided to walk down the center aisle rather than be up already at the podium and just walk in. And I wanted to see people's faces. And I saw people eager and other ones, because it was like, who's changing what we're doing? And, all it was a different type of way to provide therapy. It was the same thing that we were doing, but it enhanced what we were already doing. But therapists needed to learn how to do it because there were subtle changes, transference, countertransference, issues like that. Whereas for people who are watching who are not therapists, countertransference and transfers are just the transfer of emotions from the therapist to the patient to the therapist. Countertransference is the one from therapist to patient. But anyway, it's all about safety. So this is going to be one of the biggest questions that I'm sure therapists who are listening, but also everyone else who's listening. What is the safety of all of this? Tell us about that part.
Yes, of course. This is a very important question. And what is important to understand is that at Journey Clinical, we have an in-house medical team. And the in-house medical team, their role is to keep both the patient as well as the therapist safe. Wonderful. And what we do, because with psychedelic-assisted therapy, the key, of course, first of all, everybody needs to be trained. I think that's, as you've mentioned,
that's a must. Yeah.
That's a must. You actually, in our system, you can't start seeing client for psychedelic-assisted psychotherapy if you haven't completed training. So you can't. Like there's a button and it's gray and you can't click it. So there is a basis of training that is required. There is, of course, we also ask for people to upload their license as well as their malpractice insurance. So we have our bases covered. Wonderful. With the training. And then we also, of course, with psychedelic-assisted psychotherapy, what's very, very important when it comes to safety is patient eligibility. So our clients, first, before starting treatment, meaning before doing preparation, dosing, integration, they have a 1-hour intake consultation with a medical provider. And a medical provider goes over medical history, psychiatric history, medication history, family history. And what they look for is they go through a risk-benefit framework and any counterindications. And what is very important is...
Wait, hold on.
Yep.
That is a big thing. I just want to cut you off because I wanted to really stress what you just said. So somebody is meeting with them to see if they already potentially have a risk of this not working. So it's not everyone gets to do it. They really evaluate them to see if there's any risk.
That's
right?
Correct.
Okay. And I just wanted to...
No, yeah. Thank you. Thank you for doubling down on that because that's the foundation. We turn people down and we tell people this is
not for you.
Exactly. And this is so important with, today we have ketamine and Spravato. In the future, we'll have psilocybin and MDMA. But that, we call it a medical assessment or an intake consultation, is the foundation of our safety protocol. And at times, we also ask for additional medical clearances. So it is very possible that we will have a cardiologist give an additional medical clearance, sometimes an ophthalmologist give an additional medical clearance. So we're very strict with medical clearance, and this is the basis of our safety protocol. In addition to that, during the dosing sessions, we also um, ask patients to monitor their vitals. So before and after, and actually they need to be reported in our system as well. So the sessions are logged and vitals are monitored. And of course, there is adverse event system that has real-time response at Journey Clinical. This is very important, again, for both therapists and patients. So these are some key elements of our safety protocols. We actually have a public safety page as well that people can look
Right.
at where we outline all of our safety measures.
That's great, because I think that is a big part of it, not just for therapists, but for the people out there that are listening is, you want to make sure you're safe because you don't know what could happen, your reaction to it. The fact that you have someone there guiding you through, that you have this medical team beforehand, vitals are taken before and after, making sure that everything is okay. And I like that you're continuing with reinforcement with other of the treatment team. So what I mean by treatment team for people that are watching is all your different doctors, your therapists that are all together working for you to ensure the best experience possible. I think that's great. Tell me what age group are you seeing that's a standout for people wanting to use this type of therapy? Is there a particular age group that you're seeing?
We see clients above 18 years old. That's what we do at Journey Clinical. So we see adults.
Okay.
I would say that we have people of all ages,
Okay.
and that maybe there are more people between 25 and 45,
Okay.
but it's pretty distributed. Like that's the curve that you see. Um, Again, it goes back to eligibility. So people need to be eligible for treatment.
Mm-hmm.
People need to have a psychotherapist to do this treatment as well. So it's pretty, yes, we see people of all ages. And I think what's quite beautiful with the model that we've built at Journey Clinical is that because we empower therapists to do this work in their local communities, in a lot of instances, they do that with clients that have been their clients for a long time, where
Right.
they have built trust already. And as we talked about safety before, and you must know this and have witnessed this so many times, the depth of the work that can happen during psychotherapy has so much to do with the trust and how safe
Absolutely.
the
Yes.
clients feel.
Mm-hmm.
And so we really believe at Journey Clinical in the therapeutic alliance and that being the center of the treatment actually.
Yes, that therapeutic alliance, that build, that trust is so vital. It's an interesting thing in my practice over the years. I find myself, reiterating and restating to people, I don't get angry with you. I'm not going to get disappointed in you if you don't follow through, or you're coming back 3 years later, I haven't seen you, and you find yourself in the same spot, struggling with some of the issues. That does not come into play. It is one of the most pure relationships that people can really have. I mean, that's my feeling at a core, that with the people I see, it's this appreciation, it's this deep care, it's this level of empathy that just goes beyond, because you don't have all these negative regular human emotions that come into play. So I think that is wonderful that these therapists have learned this new technique, and then to bring it already into their practice where trust has been built. So I just wanted to restate that because I think that that's so important. What are specific diagnosis, or what are specific symptoms that you see that this course of treatment is the most effective for?
Yeah. So, from a diagnosis perspective, um, I would say we see a lot of clients with depression, treatment
Mm,
resistant depression, anxiety, PTSD, trauma. And what we often hear, and this is often the way that therapists even bring it up to their clients, is I feel really stuck.
Mm,
Like
mm-hmm.
that is the sentence is I feel really stuck. Like I don't really know. And, I've tried this and I've tried that, and I'm not really sure about my career and my relationships, and I feel really stuck. And that tends to be actually a really good entry point into bringing up that as a treatment option.
Mm-hmm.
Um, so we've seen that. I think what we also ask for at Journey Clinical is the willingness to be engaged in psychotherapy from client
Mm-hmm.
because of the modality of psychedelic medicine with psychotherapy. We want clients to be involved in their own healing journey, in their own uh, all the things that will unfold. So that's also something that we look for. And of course, then there is all the medical
Right.
safety and counterindication. It's so, for trauma, it's very, very, very effective. And
Very
it really,
effective.
yeah, it works really well.
So, can you give me an example? Obviously, not sharing names or identity, but can you give me an example, and all of us watching, of something that someone came in for and how it benefited them? What was their journey through it?
Yeah. Well, I'll share two examples that are actually public that people have like shared. So
Okay.
one was really around the theme of getting my life back.
Hmm.
And it was a veteran, a Marine Corps, that went to war, had PTSD from war, came back from war, 20 years of treatments, could not leave his home, actually. And he went through a full course of treatment with the care team at Journey Clinical. And it was very beautiful because he shared, I was able to leave my home and to walk my daughter down the aisle.
Oh, so
So that,
beautiful.
yeah,
Mm,
that
mm-hmm.
was a very, very touching
Mm-hmm.
because there's, so much suffering in this situation. And sometimes with these treatments, you're able to help people that otherwise
Won't be helped.
won't.
Yeah.
Yeah. So that was like, somebody who really got their life back
Right.
and was able to, yes, walk his daughter down the aisle,
That's so
which is
beautiful.
so,
Because I
yeah.
think most people don't realize that when someone has such a fear and a phobia that stemming from something, and in this case, um, being involved in the military, um, just my opinion, it's in a strong opinion, but a lot of times I think we just don't give enough to people when they've given their lives to our country to then show them how to we make them fighting machines, um, even if maybe they're behind the desk, they're still trained to be fighting machines just in case, and we bank on that for our safety of ourselves and our family and our nation, and then when they come back into civilization, there really isn't enough to prepare them to reintegrate back into reality of home life. And so those fears are so developed that it paralyzes them. Some people that have never experienced anxiety, depression, I hear from people all the time, they're like, well, just stop, you know, just don't feel that way anymore. I don't get it. You have so much to be thankful for and happy for. Just stop. Well, if
Not
life
that
if
simple.
life
Yeah.
would be that simple, just stop, and it's usually coming from people who mean well, just because they've never experienced, so they don't understand that paralyzing. So what a beautiful story. That one was just so touching. Tell us another one, please. I would love to hear another story of how it's helped.
Yeah, and this one is quite different. It's someone who came in with a lot of PTSD
Okay.
and trauma. As I've mentioned, this tends to work very well. and went through the full course of treatment. And what she shared was she was, sometimes people struggle to even talk about psychedelic experiences
Right.
because there are no words. And what she shared was, I started making art again. I started to paint again.
Oh,
I
wow.
started to
Mm-hmm.
express myself again.
Mm-hmm.
And that to me was so beautiful because often this is what gets lost in our
Correct.
day-to-day life and responsibilities and work and chores and for her it was, I got back to my art.
Mm.
And she sent us paintings
Oh,
that
that's
she
beautiful.
made
Mm-hmm.
of what she experienced in those sessions, what came up after for her. And
Mm-hmm.
so this is something that we see is people after these experiences, trying to integrate what comes up in these experiences is really
Right.
turning to art and remembering that they can dance, that
Mm.
they can sing, that they can paint. And I've seen that many times over. That's why I wanted to give this example because expression, which is our nature,
Right.
ends up coming back.
You know, that's beautiful because I think also with depression, one of the symptoms is loss of enjoyment in previously enjoyable activities. And a lot of times that's our passions, it's what we attach to, and they get lost over time. And to be able to have that come back. And then also, I think for parents, parents that are so, I do think it's mainly women, but that get so deeply rooted in childcare, that there is no time for absolutely anything else. And I talked about this on a different episode too, that a lot of times there's an imbalance within parenting where one feels they're able to continue their passions while another one, for some reason, does not. They don't feel that they have that same ability. So I can see how this can be, very freeing if it's locked away. Because I think people become so used to the excuses of why they don't that it just becomes their life, yet they're missing all of that. Wow, I think that's amazing. Um, Let me ask you this. Now, not everything's going to have a huge success that comes from it. Sometimes there is maybe something that went wrong. Have you seen experiences where something has gone wrong with one of these
Yes,
sessions? Can you share that with
yes,
us?
of course, of course. I think the main reason, and this is actually quite specific to ketamine, is nausea.
Okay.
So typically when there is an adverse event reported, and we have a very solid adverse event system that responds immediately,
Mm-hmm.
it's typically linked to nausea. So it also passes,
Okay.
but people can experience nausea, and for some people it can, be pretty uncomfortable. For others, it's um, they tolerate it a little bit better. And what
Okay.
we also do, we ask um, during our medical intake about um, their relationship to nausea and if they would like Zofran or any relevant medication prescribed prophylactically
Mm-hmm.
for nausea. But that's really, I would say, the large majority of
Mm-hmm.
uh, any difficult experiences with psychedelics on a medical level. Now you can see people that feel very anxious
Right.
sometimes. And I think there is something important to bring up because people in in the media more broadly
Yeah.
sometimes talk about a bad psychedelic trip. And what a bad psychedelic trip tends to be is resisting what the experience is bringing. And it's actually not bad. It's simply that you're being shown what is going on with you already.
Mm-hmm.
And sometimes it can be quite difficult to see. And sometimes people can feel quite anxious about that. And
Okay.
that's why the importance of the therapist and the therapeutic alliance is that the patient can feel really, really, really safe to experience and
Mm-hmm.
feel all of the emotions that surface. Um,
Okay.
and be in that therapeutic alliance so that the shame is okay and the guilt is okay. And that's actually when we see the most profound work happening on on the back and during the integration
Mm-hmm.
is when the client was able to go through a tremendously difficult emotion and feel safe. So I think this is really important for people to understand.
Yeah, there is a big distinction. I'm glad you brought that up because people do talk about bad trips that they've had. I mean, I've treated people who came to me just because they've had a bad trip and
Yeah.
they're experiencing trauma over something that actually didn't happen. You know, it was the effects of it, the fears that came out, and what they thought was happening, yet it didn't actually happen. It took from deep rooted fears. But most of the time, people are, with friends, they're at a party. Usually, when people do come back in, it's just in a different environment. So I like that distinction that you're in an environment where there's tremendous amount of prep leading up to it, a lot of discussion, a lot of psychotherapy that leads up to that. Then you're being monitored. Then you're in a situation where someone is there. I've even had young adults will say to me, "Oh, I'm thinking of trying such and such.
Mhm.
What do you think?" Of course, the parent in me wants to say, no, And then the other part of me is they're experiencing life, and my role is not to say yes or no. My role is to say, okay, well, if you do, this is what you could possibly expect. These are the risks. What do you think the benefits could be to doing this drug? And then from there, once they have enough education, they make their own decision. My role is not to, I can say, look, let me pull you out of fire, especially if, well, it's a different situation if somebody obviously has a chemical dependency issue. That's a whole other decision making. But I'm talking about someone who wants to explore and wants to do it safely. But again, even in that situation, I've always said, you need to have somebody around you that you can trust if you decide to do this. So I think in this situation, there has to be a completely distinct situation where you look at it and say, okay, this is in a beautiful environment. If something does happen, where someone either creates more anxiety, probably that release of control, somebody who is very controlled with their emotions, that's a hard one because you're like, some people that have issues, they'll say, I can never relax. I could never do guided imagery. I could never do meditation. And it's usually because it's somebody needs to be in extreme control and they're not able to go through it. So, but even that's therapeutic as well. And I think that's what
Exactly.
people need to realize, that even if they do struggle, everything's that teachable moment. I always say, if someone goes off and I say, hey, I'm going to give you homework this week, and they don't do it, that tells me something too. Everything becomes the teachable moment. If you're resistant, you didn't make time, that tells me something, and it should tell you something. So I see what you're saying. I see what you're saying.
Yes, because it's actually the most, and the therapists are trained. We have a training called difficult navigating difficult experiences.
Mm-hmm.
And so we train therapists for these situations
Oh,
that can
brilliant.
emerge.
Mm-hmm.
And they're so potent
Yeah.
because if you can actually work with that, that's when you see on after people actually feeling so much better, like something was lifted
Mm-hmm.
and they feel a little lighter.
Mm-hmm.
And so that's why to me it's really important to talk about difficult experiences because
Sure.
they're potent in nature.
Absolutely. Let me ask you this. You talk about ketamine, and I know you were talking about a few other drugs. Do you, is there one in particular that you see over the 3,000 that you've trained? They use a specific type, and are there different side effects? You know, you talked about nausea maybe with ketamine. Um, uh, are you seeing different side effects with different drugs? And what is the most popular one that is being used that's the most effective?
Yeah. So today, because at Journey Clinical, we only work with FDA approved psychedelic drugs. So the only drugs that we can work with are ketamine and esketamine,
Okay.
which is Spravato. And it is effectively two forms of ketamine. We use sublingual lozenge
Mm-hmm.
for our ketamine-assisted psychotherapy work, and then Spravato is in a nasal spray format.
Mm-hmm.
And what we are looking forward to adding to our offering once they become FDA approved is psilocybin in what is likely Q4 2026.
Mm-hmm.
And MDMA, we recently learned that they filed for FDA approval as well.
Okay.
So we're looking forward to adding these new modalities. And also interesting is that there are over 100 clinical trials at the
Mm-hmm.
moment on psychedelic drugs. And so what we did at Journey Clinical is truly build infrastructure for all of these drugs
I
that we
see.
can add as they come, and we build as they come through the FDA pipeline. We build medical training protocol, therapist training
Mm-hmm.
protocol around each molecule, and each of their they each work slightly differently, and so safety protocols will be per molecule as well.
Mm-hmm. I think that there's a lot that's going to be coming about, especially I think with more and more things we're seeing in the news and in research about longevity and things with just where you know where we're seeing medicine go. And I think as people live longer and they're healthier, you know, I think back to when I was a kid, you know, I think they would be on a talk show if somebody was 100 years old, you know, and you maybe you saw one. You know, now we're seeing people living so much longer and healthier, and people are working much longer. You know, you've got some people that are 65 and at the top of their game in, you know, as a CEO of a company, and you would never even think twice about someone in that position as being older. You know, they're at the top of their game. So with that though leads to more experience of life and more potential trauma and more potential interaction with other people that can cause deep rooted emotions, more fears, more anxieties, because we've seen more. And so
Mm.
I see how we're going to see more people that may feel stuck or need that extra push. Um, you know, I can definitely see the benefits. Now I know you started talking about different drugs. Is that going to be your connection with this other company you had talked about before, Compass Pathways? Can you tell me a little bit about your connection with them and what you're going to be doing?
Yes, of course. So we have been research collaborators of Compass Pathways, I believe for the past 2 years at least. And what we are working on with Compass Pathways is really figuring out how we're going to deliver psilocybin within the Journey clinical model and
Mm,
ecosystem and our 3,000 therapy practices. And at this point, we're pretty far out where we
mm-hmm,
really have mapped out the entire patient journey of what a patient would go through and
mm-hmm,
experience once Compass Pathways receives FDA approval. And I think we've also been discussing all of the training questions around how do we make sure, because this is so important, as we talked about before, when we
mm-hmm,
introduce a new modality to therapists, training is an ongoing need, and so we're
mm-hmm,
we're always training, developing new trainings, understanding what questions come up from therapists, and developing training on that. So that's also a part that we've been working with Compass Pathways around. How do we give the right training to the right providers?
Mm-hmm.
And as I mentioned, this is likely a Q4 approval. So in 2026, we will have therapists probably that will be able to offer these treatments in their own practices. And what
Excellent.
we've done in order to really prepare them for that is
Mm-hmm.
that we have with Spravato, because the Spravato has REMS, which is the risk and mitigation strategies, meaning every site needs to have a DEA license. Every site needs to have a medical professional that can
Mm-hmm.
come. Every site needs to have storage requirements. And so we have this Spravato program where we prepare these therapists to be REMS approved, to have their offices REMS approved, so that they can be the first to offer psilocybin as soon as it becomes FDA approved. That's how we've really been helping therapists get ready for that. And this is amazing because when
Yeah.
we started, this company, we were so far from where we are today.
Mm-hmm. And I just, I really have to say I appreciate all the responsibility that you've put into this and all the attention to detail, because I don't think people really realize. I think a lot of times people think it's some hippie therapist that is, sharing their stash in therapy. I do. I believe, when I hear people and people talk about it, even if it's just among friends or when I see, because I'm always online researching and seeing what is out there, especially in social media. And, even in our TV world, I know that there was a show, it's a new show with a lot of controversy. Reality, it's not Housewives. It's, yes, Mormon Housewives, which is in,
Oh,
right? Mormon Housewives or
yeah.
something like that. And
Mhm.
it's in Utah. So it's a very, very strict state, where there's, you see it throughout the show where, they drink a lot of soda because they don't drink alcohol. Yet they had this couple who went to therapy and they had ketamine therapy. And it was on TV. It normalized it. I had someone that referred that to me, and I watched the episode around that. It was done very appropriately, and they talked about how it kind of opened it up. But I thought it was pretty impactful being in a state that is so highly regulated, even around alcohol. Um, so it's getting to a new level. This type of therapy is definitely getting to a new level.
Yes, I could not agree more. And I always feel that such a big part of my role
Hmm.
is education
Yes.
and to help bring, there's a lot of fear and a lot of stigma
Hmm.
still. Less now. I think there's a
Yes.
lot of federal attention. There is a lot of movement in pharmaceuticals as well. So those help.
Hmm.
Um, But on the one hand, there is a lot of stigma. On the other hand, there is a lot of expectations as well
Hmm.
around I take a pill and my life is magically better.
Right.
And I feel
You
that
still
so
have
much
to
of
do
the
the work.
exactly. So much of the work is bringing that conversation in the middle and
Right.
say this is a treatment option. In some cases, it might be appropriate. In some cases, it might not be appropriate. And you need to want to be involved in your own work, as you said, so that you can
Yes.
get better. And I think that conversation is so important. And then when people do that,
Mhm.
what we see is actually we have 40% full remission at Journey Clinical. And
That's
that is
wonderful.
often people who it's not the first thing that they have tried. So when people understand how this works, what this takes, and are willing to be involved in that process, then the results can be very, very beautiful.
You know, I'm so glad you said that. And I kind of want to wrap this up because this has been, so educational, because I think most people did not have the full story. And the fact that we're kind of tying it with a beautiful bow here at the end, and that is that for everyone listening out there, there is no magic wand. I always say this, there is no magic wand, there is no magic pill. You still have to do the work. Therapy is a tool to use to help you do the work. Drug-assisted psychedelic therapy is the exact same thing. It is a tool to help you do the work. You still have to do the work. And I think that sometimes we're not realizing the whole thing. This is an opportunity, not for everyone, clearly not for everyone. They do a complete history of this being appropriate for you or not. But it's done so beautifully. There is a lot of responsibility, a lot of information in the intake, a lot of education. I really, really, really appreciate that. I would say keep researching. If this is something that you're thinking about doing, go look under Journey Clinical. We're also going to have a link, Journey Clinical, another link on this episode on the website, chatwithdrkat.com. Look into it, do a deep dive. If you're feeling stuck, start talking to your therapist about it. Maybe some of them are already doing it. For therapists that are out there watching this, please connect with Journey Clinical. See if there's something that you would like to see more of with that. Start taking the training, get involved. Let's just not come from a fear place. Education is power. The more we find out about something, the better. We may decide we don't like it. We may decide that this is our path, but education is power. And I have to say, Myriam, that you've done a lot of work here, a lot of work. You've made this so ethically sound. And I appreciate that, because you have to do that when you're presenting it to the world, when you're presenting it to therapists, especially therapists, because we can be so critical. We want things to be safe. And sometimes, we fear our licenses. The big bad, consumer affairs and going, and fearing the license. But the fact that you've really taken all the questions out of it, you just kind of laid it out there, and you've done a lot of due diligence. So I appreciate that. That was wonderful. Thank you so much for joining today. This can really change a lot of people's lives. And I like the fact that you've talked about, especially just education, the safety around it. What are the symptoms that this best serves? Your examples were fantastic, beautiful stories that can really free somebody who is so trapped. So thank you so much. You and I are going to talk again, because this has been so exciting, and what we can do is maybe do some other things in the future, because I think that there's a lot of information out there that we can still provide. So if anybody has any questions at all, please reach out to Journey Clinical. You can reach out to me as well. If you have any questions, thoughts, feelings, let me know. When you're on any of the different social media where you are seeing this podcast, that is me answering. So let me know if you have any questions at all. Thank you so much for watching today, and I hope you have a great rest of the day. Myriam, Bart, thank you, thank you, thank you. This was wonderful.
Thank you so much. I'm so happy that we did this.
Yes, me too. Have a great rest of your day to you and to everyone out there. Thank you.
Thank you so much.